I'm Dr. J.D. Allen, and I'm an orthopedic surgeon in White River Health Systems here in Batesville. And I'm in partnership with Dr. Angel, Dr. Carpenter, and Dr. Greer.
Hello, I'm Dr. Jeff Angel, and I moved to Batesville in 1993, so I've been here around 28 years and practiced orthopedic surgery with my partners, Dr. Allen, Dr. Carpenter, and Dr. Greer.
I tell the patients it certainly is a matter of personal decision making, but that if they really do look at true data, at the results of those who have been vaccinated versus those who've not, the outcomes of those that have been vaccinated, the vaccine works. And it's been researched so thoroughly, I think, that the further along we get with the use of the vaccine, the better the outcomes.
When I tell the patients the vaccine, that the vaccines do not have any of the live virus. They are molecules that are the same molecules in a part of the virus scene, so they can't infect the body and multiply. And so what they do is the proteins that are in the vaccine are put into the body, so the body can see that protein, develop a memory, and then get rid of that protein if it sees it again on the live virus. Some of the vaccines, especially the messenger RNA vaccines, are a two-shot series, just like shingle shot are a two-shot series, just like tetanus is a two-shot series. And the reason for this is the first shot gets you up 60–70% immunity, but that second shot boosts it way up to 90%, 98% immunity. So the first shot, your immune system gets a baseline immunity and so many antibodies, but when you get the second one, it's already seen it, so it revs it up and gets your immune system even stronger against the virus. So if you do happen to be in that 5% or so people who get the virus, you won't have bad complications or die, and also hopefully you'll be in the 95% group who will never even get the virus because your immune system has had those two shots and is really revved up and ready to attack the virus when it enters your body.
I think that you have to believe the science. And the statistics, even with this Johnson & Johnson pause that they called upon, because they had 6 patients that developed developed blood clots. That's 6 patients out of over 6 million vaccinations. So you can do the math. I mean, the side effects are, and certainly this side effect, which is significant, is very, very small. And you have to weigh I think you have to weigh the science, the knowledge that the vaccine really does work. And certainly we think that it's worth the risk. I think that the CDC, World Health Organization, all the people that are involved with this vaccination process, I think they would not put the public at large at increased risk if there was a significant side effect issue. But there's just not. I mean, the math is just not there.
For people fearful about the vaccine, I ask you just to think about math and analyze it from a math standpoint. You know, we do everything in life as a risk ratio. When we drive, there's a chance of something bad happening, somebody crosses the center line. Same thing with the vaccine. Are there some side effects in people? Yes, it's less than probably even airplanes crashing, but there is a little small risk, but the benefit is so much more greater and so more likely than having any of the side effects. It's well worth it. So even in patients who are healthy and young, think they might not need the vaccine, they will be protecting the people they know, their elderly grandparents or elderly friends, and the people who have immune disease. You may not even know it, but a person that's close to you might have an immune disease, lupus or rheumatoid arthritis, and those patients will be a lot more vulnerable if they get the disease. So it's to help others around you by getting the vaccine. It's to help yourself from getting the vaccine and having any complications that do occur even in healthy young people. And finally, it's to help us get herd immunity, where if enough people get vaccinated, we can stomp out this disease and not have it come back, at least maybe for a year or two. And we may have to have repeat vaccines, but at least we know we can get it down to where it's more like the flu or more like the common cold, and it's seasonal and is not deadly. So that's our main goal in getting everyone vaccinated. People who have had COVID-19, such as myself, should receive the immunization as well. The reason is the antibodies, or your immune system, we don't know how long it stays strong against the virus. A lot of viruses, like the common cold, is only 3 or 4 months. There's other organisms like polio, it's lifetime. So we still aren't sure if it's going to be 6 months, 1 year, 2 years, or a lifetime for immunity after you've been exposed to the virus or you had the vaccination. So it's really important to get the vaccination, because when we've done antibody testing, we know that a lot of patients have had it after 6 or 9 months, their antibodies levels are real low. So that's the reason to get the vaccination, even if you've had COVID-19 in the past.
It's just absolutely, I think, essential that we get as many people to get vaccinated as you can.